Hi, everyone. This is Jen Bogdan. We're here with the governor, Dr. Alexander Scott, and Director Smiley. We have 15 minutes for questions. Go ahead.
Governor, do you have
the conference is now in talk mode.
Dr. Alexander Scott, of the people who were pronounced dead today, do you have data on how long, if at all, they were hospitalized for?
Not in front of me. Not all of them were necessarily hospitalized. They are from a variety of settings, congregate settings, hospital settings, and otherwise.
Governor, this is Tim White at Channel 12. You have said a couple of times in a press conference that people who just don't want to go to work, they're not eligible for unemployment benefits. The direction or guidance we have gotten from DLT officials has been that if people have particularly underlying health issues or severe concerns about their exposure to COVID-19 and they quit, that their applications are being considered. So what are we supposed to tell people if that's not squaring with what you have been saying at press conferences?
Hi, Tim. It's Brett Smiley. There's a distinction between unemployment insurance and either TDI or TCI. And so you are, in fact, not eligible for unemployment insurance if you quit your job. But if you can no longer work because of a variety of other reasons, you might be eligible for TDI, TCI, or the new disaster DUA assistance. But that is a distinct different bucket of funding and different benefit level than unemployment insurance.
But they can then, Brett, this is Ted Nisi, they can go on unemployment. They just have to go on PUA unemployment, not UI unemployment.
Right.
Maybe
that is unemployment.
Into semantics here. That's not what we're referring to as UI, which was how the question was asked today. Unemployment insurance. That's a different program.
Yeah, but Brett, that when we're telling people in a live televised press conference, you got to go to work. Too bad. I mean, isn't just saying people they can't collect? Aren't they hearing that?
So. First of all, what the governor said today was that if you're in a critical infrastructure position and you're in a position to go to work, we would appreciate it if you would, because it's critical infrastructure. The question that was asked was, are they eligible for UI? That's a different program. And I don't want to be argumentative, and there is another avenue for people who are not able to work because of other reasons. That's different from unemployment insurance.
Yeah, I don't see the confusion.
Well, people are confused. That I'm just telling you that we have an email system, and they're getting, when they hear you say that, Governor, respectfully, they think that there are no avenues for them.
So okay, because you can't collect, by federal law, you cannot collect unemployment insurance if you weren't laid off.
DLT has told us, Governor, that COVID-related quits are eligible.
Quits versus layoffs?
Yes,
correct.
Quits. They said quits. We have an email.
All right. I mean, as Brett just explained, you could get TDI. There are other things, benefits that you can receive, but not the UI and not the new federal stimulus UI, which is what I was referring to. But we will try to clean it up quickly.
Thank you.
Governor, do you have any specific reports of people breaking quarantine from police departments or health department or anywhere else?
I think we had a few weeks ago. I know we had one or two a few weeks ago that there had to be enforcement on. Not many.
I have signed a number of compliance orders, which is what they use to be able to enforce them.
Do you know how many you signed, ish?
Less than 10.
Yeah, a few, Brian.
And so under your proposal, these people would now be fined, or can you fine them retroactively?
No, going forward, I just signed it today. And what I did was I signed an order directing the Department of Health to promulgate regulations, which should be done tomorrow or the next day, which will actually lay out what the fines are. For example, I'm making up a number, $100 for your first infraction or $200 for something else. So actually this will be effective after those regulations are out, which hopefully is tomorrow or the next day.
Dr. Nicole, you had mentioned that some people who died today
can you clarify how these are going to be enforced, and will any digital tracking from the tracing system be used to help enforce it?
So the technological support of the contact tracing and quarantine and isolation programs are normal elements to help us understand where people are and what they're experiencing. That helps also bring attention to whether or not there is someone who is violating. We will then access our authority as the department to issue the compliance order and work with law enforcement when it is or if it is needed to make sure that we are enforcing the quarantine and isolation.
Doctor, you said some of the people who passed away today were from...
How does that work, the technology? Will the technology, people who are in quarantine, will the technology report to you guys if they break that quarantine automatically?
There's a robust technology system that's in place with the contact tracing program in quarantine and isolation. It does include letting us know if symptoms develop, letting us know how they're feeling and if they're having any challenges with that. And we are using that to help assess when we need to reach out more deliberately to folks and determine if there are any violations of quarantine and isolation as well.
But just to be clear, we're not there yet. So where we are now is more manual than we hope to be. So, now the Department of Health calls people who are in quarantine or isolation or it's not called texts or whatever. Over time, we hope to have a GPS component and a symptom tracker component and have it be more, real time. Having said that, the Department of Health is in contact with local law enforcement, and sometimes they're the ones who will call the Department of Health. So it's a dialogue between the DOH and local law enforcement, all overlaid with the fact that we're not actually out to find anybody. This isn't about fining. It's just about, if there are quote-unquote bad actors, we need tools in the toolbox in order to enforce it.
Doctor, you said some of the people that passed away today were from congregate settings. Are you able to say where those facilities were? And if they were Oak Hill or Golden Crest, are you concerned that there's pretty much one death or more per day there for quite some time now?
Yeah, none of the deaths that we reported today were from Golden Crest. One of them was from Oak Hill, and then the others were from other congregate settings. We're absolutely concerned across all of the nursing home environments and communities, and want to be as aggressive as we can be in the regular communications with them to see how we can, stem this. But it is challenging, as it is for everyone across the country, and so, we're doing everything we can in working with them.
What are the other kinds of congregate settings that you're talking about?
Other examples of congregate settings are group homes that exist for youth, or group homes for people with intellectual or other disabilities that are present. It can sometimes be a homeless shelter where folks are in close with others.
Was the person in their 20s from one of those settings?
Yes.
A group home?
Yes.
Okay. Thank you.
Has there been a death at a homeless shelter, Doctor?
No.
Okay.
Other questions?
Do you have other nursing homes that have, or can you update what other nursing homes have a significant number of cases?
Yes, I can. nursing homes or rehab facilities with at least one resident case, the number of those nursing homes right now is roughly about 20. There are roughly 400 positive cases associated with these facilities, 270 residents and 130 staff. The total cases at Golden Crest are roughly about 75, 50 residents and 25 staff. And the total cases at Oak Hill are roughly 80, 60 residents and 20 staff. And total deaths at congregate care settings, including nursing homes, are unfortunately 29.
Governor Cuomo has suggested that maybe New York is seeing some evidence of success in flattening the curve as they look at hospitalization trends. Do you think that's the case in Rhode Island?
I don't, not yet. It's no. So the short answer is no. I mean, we're still doubling hospitalizations every, 5 days. So no, but they're a little bit ahead of us.
Governor, has there been any update on the Rhode Island Veterans Home? I know I had read that one employee had tested positive. And then also, to follow up on that, does the administration have any plans to try and connect our veterans who are unable to get to the support groups that they need?
This is Brett Smiley. There are no other employees at the home currently who have tested positive, and we've been operating under enhanced screenings and all of the additional protocols that are in place at other healthcare facilities to ensure both the staff and the residents stay safe there. And I could get back to you about the other support structures that are being made available. I'm not aware at the moment.
But no residents have tested positive?
No.
Correct.
Thank you.
Governor, any update on the Providence Park situation? And I'm not looking at it from a headline standpoint, more of a practical standpoint. If I walk down the roadway through Roger Williams Park right now, I just asked the mayor's office. They said that's not permissible. What's the story? Can I go for a walk in the park this afternoon without having to worry about a fine?
I think you'd have to ask the mayor. I'm sorry to be fresh.
No, I hear you.
I had hoped to get the mayor to a place of aligning his policy with the state's policy. We, however, were unable to do that, and he has not changed his policy. So I think the answer to your question is no. Meaning, no, you can't go for a walk.
Even though it's on a roadway, pardon me, even though it's on a roadway that isn't necessarily a part of the park?
You should ask the mayor's office.
Okay. Thank you.
Governor, I just want to understand a little bit better the citations for people that are under quarantine that were breaking that quarantine. Is that, you said it involves or it involves law enforcement. Is this where people are seeing people that are supposed to be under quarantine and people are seeing them out in the community and then they're being reported?
Yes.
Yes, that's exactly right.
Okay.
Can we get the ICU numbers along with hospitalizations?
Yes.
Mm-hmm.
Current hospitalizations are 160. 45 of those patients are in the ICU. 38 of them are intubated in the ICU.
Thank you.
Got about a minute left. Any other questions?
Anyone that's been intubated, categorized as recovered at this point?
What was that? Recovery?
Has anyone who's been intubated here in Rhode Island been categorized as recovered?
Yes. Many people have been.
Do you know how many positive?
Are the hospitals at capacity yet?
No.
Do you know how many cases there have been at the ACI?
We'll have to get you that number. Who asked the question?
Sorry, Brett, that was Brian Crandall.
Hey, Brian, we have that. We'll get it to you right away.
Okay.
Any last questions?
Ted and Tim, we'll get back to you as soon as we can on the DLT stuff.
Thanks. It is possible, Governor, that, one of the answers was on one thing. We just want to make sure we're being really clear with people. That's all. We don't mean to be argumentative either.
No. It's helpful, and to be very candid, this is changing so fast, and it's not always transparent what's coming out of the federal government, and we're all moving really fast. So just give me like an hour to square it all away, and we'll get it actually out to you all, so you can help us to, educate everyone.
Great, that would be helpful.
All right.
On face covers, can I just ask real quickly? Somebody asked me today, because I said we all need to be wearing them. It's Elizabeth McNamara. Do we really need to wear them alone, walking alone in our neighborhood?
We are encouraging the wearing of face cloth covers, and you can apply it the way you'd like to. Understanding the purpose is to minimize the disbursement of infectious particles as you are talking, coughing, or sneezing. So you could still be passing someone while walking and have that happen, where it would be helpful to have a face cloth cover. And so we'll just leave that recommendation out there for the public to do.
All right.
Thank you.
Thank you, everyone. We'll be back tomorrow.